There's a test that we do in our DNA testing that is called testing for methylation. And some of you may be familiar with this term called the MTHFR defect. I like the word variant better, or genetic variant. And it's just something that 50% of the population has. When it comes to DNA testing, you can walk in a Target now or some other department store and get a DNA test. The first thing I always ask a person who's considering that is, how comfortable are you with putting your DNA into the hands of Target? Nothing against Target. It's just that this is not a recognized medical entity or facility. They're not going to be set up to make sure that your information is kept confidential. So there's no guarantee of confidentiality. They don't even talk about it. It's not even a discussion, let alone some of the different ones on TV. One of the reasons I did not do DNA testing for years and years is because of that confidentiality. I certainly don't want to put my patients or our wellness partners at that same kind of risk. So when you get a DNA test, you want to go to a recognized medical facility where they have HIPAA compliance, those laws that promise and guarantee that your information is going to stay confidential. Just like when you get a blood test or an MRI or an X-ray, all of that is going to be confidential. Our DNA test we use has 32 SNPs, so that's one of the main reasons I did choose this particular DNA test. Some of you are familiar with the 23andMe. It's called that because it has 23 SNPs. The more SNPs tested, obviously the more information we have, the more that we can discover, what are the right choices for you so that you're making the right choices, your body type and your genetic blueprint. The other thing is that with the DNA test, you want to have something that looks at your lifestyle as well, because your DNA does not know what your lifestyle is. A DNA test is not going to include information like what's your diet like, how do you exercise, what kind of stress are you under, what kind of environment do you live in, what season is it. All of these things are going to play important parts of decisions that you make to set up a plan that's going to achieve optimal health for you. DNA test alone is not that powerful, but when you combine it with lifestyle and a lifestyle assessment, now you really have something.